welcome to Natural Health Facebook Live. This is where you can find up-to-date information on all things natural health. Here we only give you information that is backed with credible sources and reliable research. So legit, and all to improve our lives in a natural and healthy way. I'm your host, Hanis. Hello, and I'm so excited to talk about tonight's topic. Hey, before that, I want to say hello to hello Judy, hello Lim, hi, welcome. Please like and share this session so that a lot of people can talk about and ask questions about dry skin because oh my God, this is such a hot topic, especially now in this humid condition, and then we're wearing masks and we're using hand sanitizers. Hello everyone, hi Ziting, hi. And our guests here, bukan chalang-chalang, they are really important guests, experienced in their field, and they are able to answer your questions. Hello. Okay. And again, welcome to Natural Health Facebook Live. And tonight we're going to talk about a very hot topic: dry, itchy skin. Scratch, scratch, scratch. Especially now in the new normal of COVID-19, where everybody is required to wear masks outside, where everybody is required to wash their hands consistently. We have to wear hand sanitizers all the time. How can these new normal cause or worsen eczema or dry skin? Hmm. All right. So, and how should you care for dry and itchy skin? And after that, another question to ask is, what kind of products should you use? What kind of products are safe for our sensitive skin? Right. So, in this session, don't worry, we're gonna bring you experts to talk about this topic. Tonight, we're gonna have a dermatologist, and we're gonna have a pharmacist with years of experience and insight. So because of we're bringing these experts to you, you can ask me and ask them questions. Of course, if you ask me, I'm going to ask them, right? And they will explain the dry, itchy skin phenomenon in detail and will share the best tips for healthy skincare so that all of us can have a healthier, hydrated, itchy-free skin, perfect for the whole family. And of course, tonight, our session, our Facebook Live is presented by Oilum. Thank you, Oilum. Hello, everybody. Hi, Aslan. Hi, Yan Emily. Hi, Ricky. Hi. Love the energy. Keep the energy going. Please like and share this session so that a lot of us, more of us, can learn more about this hot topic. But before we begin, hi, Alex. Hi. Please say hello to me in the comment section so I know you're watching. I know you're learning. Hello. Okay, but before we begin, I have an exciting announcement to make. Are you ready? We have giveaways. We have giveaways for 10 of you out there. So that means 10 of you viewers who are lucky enough can win our ultimate giveaway for this event. So what does the giveaway entail? 10 winners will each get one Oilum personal care set valued at 60 ringgit. And I'm going to show you. Ta-da! So Oilum is one of the most popular skin care brand sought after in hospitals, in skincare clinics, and pharmacies. Very well known. And the premium Oilum personal care set giveaway today comes with a Hydro Rebalanced Firming Cleanser, award-winning, and the award-winning Derma Firm Lotion. So you got a cleanser and a lotion in one set. This is what you can win in our giveaway. Again, 10 winners will get to walk away with this premium set by Oilum valued at 60 ringgit. And a bit about Oilum, I would love to share that Oilum is an established personal care brand that won the 2020 Natural Health Award. Oilum was awarded in the Best Moisturizing moisturizing cleanser and best moisturizing lotion category for dry and wrinkled skin. So more about Oilum, this is where I'm excited to share these details with you. So for those who, I'm sure you are already familiar, but for those who would like to know more about Oilum, this is what you should know. Oilum is formulated by dermatologists, so you know that it's high quality. And secondly, it has olive oil and has collagen, good ingredients, and it maintains the skin's natural protective function. It's rich in natural antioxidants and moisturizer, and fragrance free, paraben free, and formulated with anti greasy or non greasy formula. And I'm happy to share that Oilum lotion, the lotion, has been proven, clinically proven, to improve natural hydration of the skin in only 3 weeks. So this is already clinically proven, and it's supplemented with skin anti-aging substances. So there you have it. You lucky winners will get to win this Oilum set for 60 ringgit value. So lucky winners will get this together. The award-winning Oilum Derma Lotion and Hydro Rebalance Firming Cleanser. Thank you again to Oilum for presenting this natural health Facebook Live for today. And before for the giveaway tonight, you can win this, and all you have to do is, okay, hear me really close, okay? All you have to do to win is that, number one, like this Facebook page, Natural Health Facebook page, and like Oilum Malaysia Facebook page. Number two, like this Facebook Live and share to your timeline, okay? And number three, last but not least, go to a comment below and comment, tell me, why do you need Oilum set in your life, and tag 5 friends to join this live event. Again, 3 steps only. Number one, like this Facebook page and Natural Health and Oilum Malaysia. Number two, share and like this Facebook Live. And number three, go to the comment section. Tell me, why do you need Oilum, and tag 5 friends. Super simple, super easy. Best of luck. I hope for the best for you. And this giveaway will run from this live until Monday 6 p.m. only. So be sure that you're going to be in the running. Be sure that your answer is good, okay? Again, we'll run from this live until Monday 6 p.m. and we're going to announce the winners on Wednesday. And now I'd like to introduce, without further ado, let's get the ball rolling. I'd like to introduce our first guest from Pantai Hospital, Penang, dermatologist Dr. Loh Dee Win. Before that, a bit about Dr. Loh. He completed his medical degree in University of Malaya in 2008 and became a specialist in 2014. Dr. Loh is a fully registered dermatologist specializing in eczema, psoriasis, skin infection, dermatitis, drug allergy, autoimmune venous diseases, pigmentary disorders, hair, nails disorder, and sexually transmitted diseases, STD. And he's also currently a visiting lecturer at Ames University. And with that, without further ado, to talk about dry itchy skin topic, let's welcome Dr. Loh Dee Win.
Hello everyone. Hello
Hello,
Hanis, how are you?
doctor. I'm good, fantastic. How are you, doctor? You told me it's a very long day for you.
Yes. Hope I can share more knowledge with all the audience today regarding
Yeah.
dry and itchy skin.
Now, I'm super excited to have you here. And you know what? It's so touching to have you here, regardless of your busy schedule, because I think you just shared with me this topic is very important to you, right?
Yes.
Yeah, amazing to have you here. And now, while I get you get comfortable and you get settled, Dr. Loh, I'm going to share a bit about our second guest that will be joining us today, a very established pharmacist and a respected individual, important figure in Malaysia's pharmaceutical industry, Mr. Andrew Tan. A bit about Mr. Andrew Tan. Mr. Andrew Tan is currently the Deputy President of the Malaysian Pharmaceutical Society and the Managing Director of Md Pharma Director. He received his bachelor's in pharmacy at the Science University of Malaysia. After years of working in hospitals and corporations, he then pursued his MBA. And with that knowledge, Dr. Loh, he has helped build Malaysia's leading dermatology brands until today. And with that, let's give a warm welcome to Mr. Andrew Tan. Hello, Andrew.
Hello,
Hello
everybody.
Andrew.
Hi,
Hello.
hi,
How
Hanis
are
and Dr.
you?
Long. Good.
Hello.
I'm fine. Good.
Happy to have you here joining us, Andrew. And before that, let me congratulate you for MD Pharma's win for the Natural Health Awards. A bit about that, if you'd like to share.
Yeah, thank you for everybody's support, especially my customer, my family, and also my lovely consumer and the leaders of natural health for their support. So it's a big recognition for Oilam Brand and also my company MD Pharma. And with this to this opportunity, I also thank my team, MD Pharma team, to make this happen. Thank you very much.
Congratulations, heartiest congratulations. We're very proud to have you here. And okay, let's cut to the chase. This topic is a very hot topic. Now, in the new normal pandemic, COVID-19, we're a year plus already. We see a lot of dry, itchy skin. I don't know if this is a coincidence or this relates to the new normal. And with that, let's talk about dry skin a bit. Let's dive a bit. What is the situation now in Malaysia, especially in the new normal? I mean, what can be observed at clinics and pharmacies? Maybe Dr. Low, you'd like to share your insight first?
Okay, sure. So I think first of all is during my clinics, almost like every day I will see patients come with me with dry skin, itchy skin, and during this COVID period is most of them actually they didn't realize that it's due to their hand sanitizer and also due to the face mask that you use. So every day we see these patients, and I hope this topic can help those with this problem, give them some tips to actually reduce this dry and itchy skin.
So, doctor, you're telling me, is there an increase in people who come to you because they have dry skin?
Yes, yes, definitely,
Oh,
definitely.
that's worrying. And I'm glad that we're having this topic now. Hello, Marissa. Hello, Nurul Najiha. Hello, Karen. Hello, Bun Bun Chua. Great to have you here. Please like and share this session so that we can learn together. And now to you, Andrew. My question is, what's different in the trends of what people look for over the counter at pharmacies when it comes to skin health during this pandemic? If you can share.
Yeah, I would like to share is since early last year, this COVID-19 pandemic has make us uh, to live in a new normal way. And here I would like to share the basic three things, three trends. One is self-care priorities, and
Mm,
then second is hygiene. Everybody know to take care of their hygiene, and no, our DG always emphasize wash hand with a soap bar. So
yep.
why we wash hand with the soap bar? Because the soap bar has this surfactant which can help us to not trap the virus and also bacteria, so that to make sure that we prevent from this COVID-19 virus.
Mm, true.
And
True.
third thing, then the other one, just back to the self care. Now because of the due to the MCO, everybody need to stay at home. So hardly go out to see, go to beauty spa or whatever to do their facial. They have to do at home. So everything have to do yourself, have to take care of yourself. Then they have to, from here, they have to learn how to choose the correct facial care, skin care to manage their skin.
Mm,
Okay.
mm,
So from here, then third things I would like to share is digital. I think we enter into a digital era, online. So since not last year March, our the beginning of the MCO,
mm.
everybody no chance to go to shopping mall and do shopping.
It's true.
Correct.
And I think,
So
yeah,
online become our part of our life.
it
So
has.
everybody will do online purchasing. So
Mm,
one thing is here I would like to share is uh, I need to cautious the consumer.
mm,
Online purchasing, so have to make sure that whatever you buy online, you need to make sure that it's a good quality and it's from the reliable source.
mm.
Okay.
Okay, Andrew. Now, because you mentioned about COVID-19, also, why is it important when everyone else is talking about COVID-19, how to react, how to precaution against the pandemic? Why is it important to talk about dry, itchy skin now when everyone else is talking about that?
Oh, okay. Why people talk about dry and itchy skin? Because now last year we need to start wear use a sanitizer wherever we go. Even every moment that we touch the things outside, we need to use sanitizer. And this sanitizer cause dryness of our
Mm,
skin. And then we compulsory to wear face mask because
mm,
face mask to prevent COVID. Okay,
mm,
face mask sometimes if you cause the dryness of our face also, beside causing acne, you call
mm.
mask acne.
So it's very important because we have this mass media trend. Okay,
Yeah.
and with that, I think I would love to dive deeper into the more clinical aspect of dry, itchy skin. And for that, Andrew, I'm gonna let you rest first before I grill you later on the solutions. All
Okay.
right, we'll see you in a bit. Okay. Okay, stay on the line. Okay, Dr. Low, let's get
Yes,
right
yes.
to it. I think at the same time, before that, Dr. Low, to audience, hello, ladies and gentlemen, please keep your questions coming because what I'll do is I'll read your questions as we go along. You know, probably Dr. Low can have the magical answer to your question. All right, so Doctor, dry skin may sound straightforward, right? But you
Yeah.
know, how do we know for sure that we have dry skin? For example, like sometimes my face is oily but my skin, my body is dry, or like in the morning it's dry but like later in the evening it's oily, or some parts oily. How do we know for sure, doctor?
Okay, so first of all, I think to answer you, the most important thing is we need to know our skin type.
Mm,
So basically, skin type have three types. So if you have like a dry skin, most of you will actually have this flakiness, scaling, itchy, and even in severe cases, some people will have like a fish scale type of scale over your hands, over your forearms, and also over your shin, and you'll feel itchy most of the time. But for normal skin, you basically won't feel anything. It's just normal for you. But for oily skin, at the end of the day, because our skin secrete oil, you'll feel your face especially will become oily. But some of us actually have a mixture, meaning we have like a mixture of dry and oily skin. So for the oily skin, most of the time is over the face, but the dry skin, it will actually happen over the forearm and also over the legs.
hmm.
Yep.
Oh, that's forearm and legs. Okay, so that's interesting. Because I think a lot of people get that mixed up, right? So
Yes,
again,
yes.
audience, if you're unsure what kind of skin you have, please ask us, and then we'll be happy to help. And okay, doctor, in general, dry skin, people say sometimes it's because of our genetics, because of what we eat, or because simply we get older, right? Because of age. So, in your professional opinion, what are the deeper reasons or the deeper factors of dry skin condition? And additionally, the reason of the itch, the gatal-gatal that comes with it. Over to you, doctor.
Okay, so I think a lot of us know that to have dry skin, there's a lot of factors. One very important factor is actually family history. Family history, when your family members having skin conditions like dry skin, sensitive skin, but not just limited to skin. Some people will have a very sensitive eye, sensitive nose, or resdung we call in Malay, or even
Mm,
like asthma. They tends to have very dry and sensitive skin. That's for the genetic parts lah. So secondly is about our age. As we age, our skin tends to reduce what we call as a natural moisturizing factor. So this also contribute to it. So especially for women, after the menopause, their skin tends to be drier also due to the similar factors. Not
mm,
to forget about, the environment. The environment also play a very important role. So what I mean by environment factor is like something externally, even like our hand sanitizer, even like face mask that we so need to use every day during this pandemic
mm,
era. Those are the things that can trigger. And some household product actually can trigger very dry skin. For example, if you use very harsh body wash,
mm.
especially some of us like the antiseptic wash so much, we feel that by antiseptic wash, our body will be clean, no
Yeah, bacteria,
bacteria.
all bacteria in the world die already.
Yes, yes. But what it come with the consequences, meaning that if our skin is very sensitive and dry, at the end of the day, if you use that so frequently, our skin will become so dry and it will contribute to itch. But now I'm going to tell you what actually the relationship between dry and itchy.
Mm,
So first of all, if we have dry skin, most of us tends to have itchy skin.
mm,
It's actually part of our skin physiology, meaning when our skin is dry, it tends to tell our brain that our skin is very itchy. It can be
mm,
part of the protective mechanism so that we will remove whatever things that trigger the itchiness. For
mm,
example, let's say we go out for a walk, they might have insect bites. So it will actually trigger us to say, oh, our skin is very itchy. So we will actually try to find out what's wrong with it. Of course, there are some other skin conditions which can cause our skin to be very itchy. For example, eczema, psoriasis, seborrheic dermatitis. All those skin conditions can actually cause itchiness.
mhm,
And lastly, not to forget about allergic reactions. So I think during this pandemic era, as Mr. Andrew just now said, most of us like to buy online products so much. But
mhm.
if we don't know the ingredient, if we don't know what is the content, we buy it because some other people say it's good for me. We use it. We can actually have allergic reaction, and it will manifest as skin itchiness and skin dryness, and may have a lot of complications after that. So we need
So,
to be very, very careful.
Doctor, that's interesting because actually there are a lot of factors, genetics, age, and like basically household stuff that can cause this itchiness. Okay, I've got a question from Weng Sum. And this actually relates to my next question. Weng
Yep.
Sum is asking, is it normal to have dry skin after you step out of the shower? All right. So that's shower in general. But I guess my the question that relates to this is that, because of this now rainy weather, and then just a few months back we have really hot weather, and then because of this pandemic we stay indoors, and then all the time we are very like air conditioned full blast, right? And then we go outside, it's hot, we go inside, it's cold. Does this sudden change of temperature from outdoors to indoors lead to dry skin? And when it comes to temperature, does it matter washing face with cold, lukewarm, or warm water? I think this also relates to what Weng Sum is asking. Shower situation.
All right, all right. Okay, I think a few questions here. So answer Wing Fong, right?
Mm,
Questions. So first
Weng
of all,
Sum.
some of us after taking bath will feel itchy. Possible causes can be the body care things that we are using may not be suitable, meaning that we might use a very harsh body wash. So
Mm,
after using, it may actually cause this itchiness because of the irritants that we've been used or other skincare product that used during the bath lah. Of course, changes in temperature also play a very important role. As you said, during this pandemic, we stay at home, duduk at rumah.
rumah.
The aircon we open full
24/7.
blasting aircon. Yeah.
16 all the
So
time.
yes. So what will happen is that the aircon actually is reduce the humidity in our room environment. As our room humidity reduce, it will actually trigger the dry skin even worse. More so if there's extreme weather changes, like from very hot weather to
Mm,
dry and cold in our room, it also can trigger it. Because when it hot, I think most of the sensitive people will agree with me. When it's hot, you tend to sweat. When you sweat, it will actually attract a lot of dust, and it will stick near the place that you sweat a lot. You'll feel very uncomfortable and itch. So if you suddenly go into the very cold and dry room, you may feel relief for a while, but we tend to forget to take bath. Then all the dirt and also the sweat will actually cause us to be more itchy after that. Yeah.
You know what,
So
doctor?
that's why, yeah.
It's not because forget to take bath. It's because we malas to take bath. because I think like a lot of people
Maybe.
staying indoor already, so like not as dirty. But yeah, that's valid answer. So I hope that answers questions of some of our audience. And so yeah, temperature does play a part apparently. And you know what, doctor, a lot of people have our questions here. But before that, I want to remind everyone, please like, comment, and share so that everyone can learn. I think this topic is very, very important, not just for you guys who are watching, but also for your friends, for your family. Because, like for example, Vanessa Jane has mentioned that she's having this massive acne, maskne going on. So I can relate with you, Vanessa. And Marissa Tay is saying that she's having these dry cheeks. Her skin are actually peeling on the sides of the cheeks. So I guess, Marissa, this is a great platform for us to learn more. And I think Chi Xiu Ping had a question just now. Let me just go ahead and read that. Chi Xiu Ping. Okay. Hi, Dr. Low. How can we solve problems like dry, sensitive, cracked lips besides than lip balm? This is something I'm interested also. Thank you for your question, Chi Xiu Ping.
Okay, so for to answer this, we need to find out what actually trigger the dry and cracked lips. So dry and cracked lips actually very common after we wear the face mask, especially the face mask that irritate our skin. So if it's due to the face mask, make sure the inner surface of the face mask is not synthetic fiber. And if you have due to the face mask problem, you may need to change to something which is more gentle to your skin and lips, which, for example, is cotton, silk, even bamboo fiber, things like that. And of course, when we wear face masks, if we like our work need to talk a lot like honeys, then we may not be encouraged to talk so much when we wear a face mask because it will actually cause friction. You just imagine this is the mask, this is
Yeah,
our lips, we just keep on friction. So that actually worsen the dry lips and cracked lips. Of
I
course,
see.
other than lip balms, we may need to use a good moisturizer for our lips. And in the case that it is like very itchy, sometimes we may need topical medications like topical steroids to reduce the inflammations.
Mm.
So, in short, we need to know what trigger the dry lips and treat the underlying causes.
I see. I see. Okay.
Hope that
Thank you.
answers your questions.
Yeah, the thing is, I think it answers the question too because yes, I do have cracked lips. Thank you so much for the one who asked. And okay, I would like to take this opportunity, Doctor, to share with the audience again to those who have joined us. To those who have joined us, welcome. Hi, good evening. I'm Hanis, your host, and you are now at Natural Health Facebook Live event. In this topic, we're talking about dry, itchy skin, kulit gatal dan kering. Okay, and for this session, we are giving away to 10 winners this amazing premium personal care set by Oilem. Let me show our audience, Doctor, what they can win. So you can win this set valued at 60 ringgit. If you win, you get them together. One is Hydro Rebalance Firming Cleanser and one is Derma Firm Lotion. So this cleanser and this lotion comes together if you win, and the best part is it's just won the Natural Health Award 2020 in the best moisturizing lotion category and the best moisturizing cleanser category for dry old skin. So that's our giveaway. It's really premium, guys. And you know what? Oilem is one of the sought after brands in skin clinics, in hospitals, in pharmacies. So get yours today, okay? So how do you want to win? Super easy, super simple. All you have to do is 3 steps. Step one, like this Facebook page, Natural Health Facebook page, and like Oilem Malaysia Facebook page. So 2 Facebook pages to like. Number two, like this Facebook Live event and share to your timeline so they can see my face, they can see Doctor's face, and most importantly, they can learn about this topic. And number three, comment below why you need Oilum set and tag 5 friends. Super easy. 3 steps. Like this Facebook page, like National Health and Oilum Malaysia. Number two, like this Facebook Live and share to your timeline. Number three, comment below why do you need Oilum and tag 5 of your friends. Super easy. And on that note, don't forget to ask your questions because the experts are here to help you out. Okay, doctor. Now, I would
Yeah,
like to
yeah.
ask you, what are the typical symptoms for someone who has dry skin? I think you've mentioned just now your flakiness. Maybe you can go into detail more. And because our climate is unique from the rest of the world, can you share with me the most common symptoms for dry skin patients in Malaysia?
Okay, so for dry skin in Malaysia, most of the patients will feel itch, very common. Secondly, they will feel their skin is very rough. When they rub it, they will feel like it's very,
Kasar.
very dry and very, very rough.
Hmm.
Yes, very, very kasar. So some of them will actually feel flakiness, and in severe cases, they will see, let's say, their hands and legs is very dry. They will see cracks. Sometimes it's very deep cracks, so they will feel the pain actually. But for some people, if they like after using wrong products, their skin become very dry. They might feel skin tightening over the affected area, like lips, over the face. Yes, that will be one of the common symptoms as well.
Mm-mm. Okay, then that helps. So for those managing dry skin and itchy skin as a symptom to an underlying condition like psoriasis, right, or infection, what is the course of treatment that you recommend to manage the dry skin caused by that? And you know what, doctor? This is related to a question that we had. This person was asking, how do you manage treatment for psoriasis? By Xiao Lian.
Okay, all right.
Treatment,
Xiao Lian,
psoriasis treatment
okay.
options. Yeah, Xiao
So
Lian.
okay, so I think for either eczema or psoriasis, they patients tends to come to me with skin dryness and itchiness. So first of all, very important, we need to know the correct diagnosis. If you're very sure it's actually psoriasis, then treat the underlying cause. So treat the underlying cause for psoriasis. First of all, very important. I have this mnemonics TIMES times. What does it mean? Is actually identify the trigger factor, meaning whether there's any trauma, injury, even if like our own scratching is actually worsen the psoriasis. We need to stop that. Secondly, infections. Any infections like skin infections, even normal common cold, things like that, it will actually trigger our psoriasis. And third M is actually medications. When we have skin disease like psoriasis, we cannot simply take medications.
Mm,
Certain medications will actually make our psoriasis worse. So if you're not sure whether the medications will worsen your skin condition, please ask your doctors. Okay.
mm,
After that, E is actually endocrine, meaning let's say some people get pregnant. During the pregnancy, the hormonal changes will actually make the psoriasis or the eczema worse.
mm,
Depends on the phases of the pregnancy. And
mm,
lastly, stress. We need to any stress will actually cause whether the psoriasis or eczema to actually flares. So we need
mm,
to avoid stress and treat the stress. Of course, for psoriasis and eczema, let's say we have a very dry and itchy skin. Very important, which I need to say 3 times, is we need to use moisturizer, moisturizer, and moisturizer. So pick an ideal moisturizer for your skin to actually
mhm,
reduce the skin dryness and skin itchiness. That is
mm.
one of the most important factors. So
Then,
some people will, yeah, yeah. You asked the
yeah.
question, am I?
No, I love when you get into the details. I think you can add more later. But because you mentioned moisturizer, then my question is, what should we focus on in our daily skincare? Is it hydrating? Is it locking in the moisture? Is it protecting or letting skin breathe? And will the skincare routine be vastly different from someone who has normal skin? Mm.
Okay. To answer your questions, again, I need to say again the same thing. Moisturizer, moisturizer, moisturizer. Very important. Important things need to repeat 3 times, lah. Honey.
True, true.
Okay.
And
So
yeah.
yeah.
Mm.
So moisturizer. To choose a correct moisturizer, we need to notice few things, lah. One, we need to look at the labels correctly. To look at the ingredients. Very important. Normally, they will mention hypoallergenic for dry and sensitive skin, no preservative, no paraben, natural ingredients. That's the things that we look for. And there are different vehicles like lotions, gel, ointment. All those actually there's no best vehicles. We need to choose the most ideal moisturizer that you will use, that you find comfortable to use, and that help you to improve your skin conditions. Of course, not to forget about cleansing part as well. Avoid harsh cleanser. Try to use something with a gentle, no preservative, no antiseptic, strong antibacterial properties, so that your skin will be protected lah.
Yeah, you know what, doctor? I think this perfectly answers Lim Yung-ju question because this person was asking how to choose the right moisturizer. So that's perfect timing on all ends. And okay, before we re-invite Mr. Andrew Tan, please tell us what is your own skincare routine to maintain healthy, hydrated skin and avoid dry skin altogether.
Okay, so for me, my dry skin is very mild, mainly over my forearms and legs. So most of the time, I just use moisturizer, which is suitable. How frequent I use? I use as frequent as possible. Why? When I feel itch, to avoid the scratching, I will put on the moisturizer and rub it on. In fact, I teach my toddler to do so, so that they will know that when they feel itch, they will tell, or they will look for cream, look for moisturizer. So that's what I do for my dry skin.
Mm-hmm. And I feel that's it. That's the holy grail of hydrated skin. Take it from the doctor. And on that, Doctor No, I this is my pleasure to re-invite Mr. Andrew Tan, our one of our leading figures in the pharmaceutical industry. Mr. Andrew Tan, are you still there?
Yeah,
Because
I'm
we have
here.
questions for you. We have important questions for you.
Oh,
And okay, I think we've covered how COVID-19 has affected us because we use hand sanitizers and all, and the mask we wear limits our breathing, skin breathing. Um, but I would like to ask how there are so many trending skincare routines now, from face massaging to exfoliating. Are there any skincare routine that you do not recommend to dry skin patients? Or should some routines be limited to just once or twice per week? Maybe Andrew, you can take this.
if you have a dry skin, like
Hmm.
products such as like peeling agent, those who cause a dryness, then I think you should avoid. Product like whitening product, like hydroquinone, all these you need to avoid. And then also, especially exfoliating agent, you try to avoid, try to use those products that contain moisturizer.
Hmm.
Okay, and then those product contain glycolic acid, try to avoid for dry skin also.
Mm-hmm.
And then in term of okay, in term of food diet, try to avoid alcohol and caffeine.
Oh, I
Those
see.
coffee lover drink moderately. For example, like me, I have to cut down my coffee if
Alamak,
I have
I'm doomed.
very dry skin. Okay, then also try to avoid those product contains fragrance.
Hmm.
Mm.
And Andrew, we have questions here, interesting questions from two people. Oji Bala was asking, how should you watch out for toxic properties or toxic ingredients in moisturizer? That's what to avoid. and what to watch out for. And then second question from Farah Ilyana, she's asking, is ceramides good for dry skin? Ceramide ingredient. So two questions
Okay.
there. Hmm.
So question the first question is a toxic ingredient.
Yeah, how to watch out
So
for toxic ingredients.
basically, I think before you buy the product, that's why it's good to have to visit. Uh, Normally, I would suggest the consumer to pay a visit to community pharmacy first,
Mm,
because in community pharmacy you can hold the so-called the label of the product. Then you can read the ingredient list.
mm,
Then from here you can identify whether the ingredient is toxic or not, and then you can ask the opinion and from the community pharmacy.
mm-hmm,
Second, when you visit the clinic or dermatologist, the dermatologist, I think they will they will not use the product contain a toxic ingredient.
mm.
Okay, so I hope I answer the question.
Ojibala's question. Then second question, ceramides as
Second question,
ingredient.
ceramide.
Is it good?
Ceramide, I think,
Mm,
it is a good ingredient for dry skin.
mm,
And I think in the market there are many product contains ceramide. I think people use it for eczema skin,
mm.
especially eczema. They have a lot of so-called dry skin. So ceramide will help.
I see, I see. Okay, so I hope that that answers your
Thank
question.
you.
And you know what, Andrew, we have a lot of questions regarding, what are the right products? Am I using this right? Can I still apply if I have allergic reactions? There are some questions about allergic reactions. That's something I'm interested on, and I know that you're going to touch about that later on. But
Okay.
now I would also like to ask, Doctor, back to
Hi,
my
hi.
question.
Yes, yes.
Any face maintenance routine that you would advise dry skin patients to avoid, like exfoliating, massaging?
Okay, so massage actually still okay as long as you choose the correct skincare product that you use to
Mm,
do the facial massage. You use something that increase the hydration of the face of the
mm,
skin. Go ahead and do it. As for exfoliating, I not really recommend. But let's say you really feel that your skin very dry, very ugly, you want to remove, yes, you can do it, but you may need to reduce the frequency lah. Maybe once a week or even once a month. Then need to
mm.
choose the correct product as well.
What happens if we over exfoliate?
Our skin will become exposed. It will actually become like very red, and it
Oh,
may get infections as well. So it will get infected over the face. What will happen is it will become very pigmented, especially for our Asian skin.
I see. You know what? I think like there are a lot of trends out there. If you exfoliate using this brush or this silicone product every day, then you have that glowing texture. But I feel that, yeah, I agree on that insight. Thank you for that. Okay, now this next question, for both Andrew and Dr. Low, feel free to answer. But in the meantime, in the audience, please continue to like and share and comment. Let us know your questions below. We'll try our best to attend to your questions. Dry skin may be a medical condition, like we've just discussed, or it may be a symptom for another underlying condition. So, doctor, maybe you can answer this. What is your advice for people who are experiencing dry skin to ensure that they are getting the right medical attention that they need?
Okay, so if we have dry skin,
Hmm.
most of the time we don't need to see the doctors lah, unless the doctors is very handsome. Then you want to go to see a
Very
doctor.
handsome. Like that.
Well, many want
Okay,
to see Dr. Low.
okay, but to
Well,
answer this question is that if the dry skin that you are having the problems not responsive to the moisturizer or the skincare that you use, you can go to seek the doctor's advice for any other skincare product, or whether your skincare product there any wrong with our skincare product, or whether
mm,
it's not suitable. Of
mm,
course, there are other very important things is that if the dry skin and itchy skin affect the important area, like your face, your lips, your hands, that you need to write every day. You need to seek treatment as soon as possible if it doesn't respond to your normal daily routine of skincare. Okay,
Mm,
and
mm,
thirdly, not to forget, if you notice that the skin area become infected
mm.
meaning become red, even have like serious discharge, in worst case may have some pus, that
Yeah.
is the time that you need to go to seek medical treatment. And if the itchiness and dry skin affect your daily activities, like you cannot sleep, you feel depressed, there's time that you should go to seek treatment immediately.
Then you know what, doctor? I think now, especially in the trend of Google, everything I know, I just need to Google, right? Everything I just want to know. In the trend of self-diagnosis and self-medication nowadays is a trend, yeah? And all these DIY home remedies. You've mentioned that okay, seek professional help when you've experienced this and this. But for Andrew, what is your opinion? When should people who go to the pharmacy go to see the doctor before it worsens? I know that you mentioned, pharmacists are trained to some extent. Maybe you can explore more on that, share more on that.
Oh, okay. The share is, I think, back to a pharmacy, community pharmacy. They are so-called the private community pharmacy, which is the so-called primary care for the so-called to serve the community. So I think that those are mild cases. Example, mild eczema. So the patient come with just a dry lesion, dry skin. They can go to see, go and seek some advice from the community pharmacy. So probably you can. I think the eczema, the management of eczema, the first step is basically you use the correct cleanser, and
Mm-hmm.
then second step is the moisturizer. Like what
Mm.
Dr. Lo just now mentioned is three things. Three must shout loud, three words. Moisturizer, moisturizer, moisturizer. Okay? So
Okay.
in every community pharmacy, there are many so-called moisturizer for them to choose.
Mm.
Okay. So this community pharmacy also are trained to give advice what
Mm.
moisturizer is suitable for a different type of the skin. And
Mm.
that
Mm.
if the condition getting worse, let's say go into a severe eczema, and then this is the time that the community pharmacy will ask the patient not
Mm-hmm.
to refer the patient to see dermatologist
Mm.
for further investigation.
Mm.
So probably
And-
in further treatment. Uh, like for example, like just now Dr. Low say, if the patient come to say complain about like I got the dry skin, but I cannot sleep every day. I depressed. I cannot go to office in the peace. So I think you need to see doctor,
mm.
dermatologist to check the underlying
Underlying
condition.
conditions. Yeah, that perfectly summarizes
Mm.
the question that I was asking. Now, again, to the both of you, this question: when talking about our tools as consumer, right? If I have dry skin, if our audience have dry skin, how much should we rely on skincare products? That's one. And how much should we rely on supplements or prescribed medications? Yeah.
Okay, I think I'll answer first, but I think my all the audience already clever already. So I think the answer will be moisturizer, moisturizer, moisturizer. I can see the comments. Some of them already comment like this.
Moisturizer,
Very, very
moisturizer.
clever. Everyone is very clever now.
Oh,
So first of all, I think moisturizer very important. First
Mhm.
thing. Okay. Second thing is for supplements and medications to increase our moisture. I mean skin moist. We actually food can help. So
Mm,
for certain supplements like vitamin C, vitamin D, some even like probiotics that can actually help to increase the moisturizer. But if
mhm,
you can take it naturally from the food is even better because I mean it's become a habit of us to actually take the healthy diet. But of course, let's say your diet, you don't like certain food, you lack of certain minerals, you may need to take supplements for that
Mm,
purposes. I think
mm,
Mr. Andrew can enlighten us more on that aspect lah.
mm. Any case studies, Andrew, you'd like to share?
Yeah, I agree with Dr. Low. The three things: moisturizer, moisturizer, moisturizer. Whoever got dry skin, moisturizer is the key words that you need to think about, and you must remember that three words: moisturizer, moisturizer. Okay, basically for dry skin, uh, talk about supplement. You can. I always believe that you can combine both skincare and also supplement instead of we are not talking about medication. We talk about supplement. You can combine to manage the dry skin also, especially those eczema patients uh, or skin allergy. And I think I have there's a testimony want to share. Probably can
Mm.
show that I just briefly share the testimony.
Oh, the
It's
testimony. Oh, you have
faced,
we have a testimony for
yeah,
that.
yeah.
Okay.
So basically, it's faced by one of my friend's daughter, who is 4 years
Mm-hmm.
old. Okay, so she got skin allergy. Basically, she
Mm,
tried. It, actually, she went through a lot of things already.
mm,
But the day I just no, uh, I just share with them. Why not you try this concoction? Moisturizer, moisturizer, moisturizer. So skin allergy or eczema skin, the most important thing is a moisturizer. So I just very simple. I just asked her to try on this Oilum moisturizing soap and Oilum Dermafirm lotion.
mm-hmm.
So she go back just try without letting me know. She take a picture and then she try 5 times a day.
Mm-hmm.
She apply on the skin, the hand, 5 times a day for five
Mm-hmm.
days. So
Mm.
after 5 days, uh, this is the result
Mm.
that she got
That's
immediately.
interesting.
Yeah. So I also got excited. So she called me. She called me and tell me about the news. I got excited. So I asked her, "Did you take picture?" So she said she got take picture because that when you are desperate, you will try everything. So this is one of the things that the moisturizer will help the dry
Mm.
skin, especially those are dry and itchy skin. And
Okay, Andrew, I have a lot of questions on that. I think we can talk to you would like to talk about in detail about oilum. But before that, of course, by now we know that maintaining healthy,
yeah,
hydrated skin is not as simple as splashing water onto the skin. So by now
correct.
it's moisturizing, right? But for a moisturizer or a product to be effective with long-lasting results, what are the main ingredients needed to manage dryness? I know that we just mentioned, what are the things to avoid, what are the things that are okay for dry skin, but in your opinion, what are the main ingredients that we need in a moisturizer?
Okay, there are many ingredients that you can use as a moisturizer. For instance, like hyaluronic acid. Just now you mentioned the ceramide, glycolic, this so-called glycerin, not emollient. You have urea. Then the other one is olive oil.
Hmm.
Uh, so so back to this one just now. You want me to explain oilum. So in this oilum, basically it contains olive oil and collagen. Okay, a lot
Hmm.
of people doesn't know collagen. I want to share is that collagen doesn't work externally.
Hmm.
Okay, collagen when you take orally, it works in your body, but
Hmm.
externally, it not really work. But the best thing is this combination, olive oil and collagen, if you absorb into your inner layer of the skin.
Hmm.
So from here, this olive oil will hydrate the skin from inside out, and then collagen will work on the dermis layer to firm the skin and also do some repairing
Mm.
and protect the skin.
I see. Now I think our audience, they have a lot of questions. I think don't worry, we will get to your questions later. But before that, I just like to quickly remind everyone of our giveaway. Again, you can win a set of premium personal care set by Oilum. This is award-winning product 2020 Reader's Choice Award. For the Hydro Rebalance Firming Cleanser and Derma Firm Lotion, right? So if you win, you get one set valued at 60 ringgit. That's a lot. And all you have to do is like our Facebook page here, like Facebook page Oil in Malaysia, like this Facebook Live and share to your timeline and comment below why do you need this Oilum set. Tag 5 friends, and that's how you got in the running to win. And I think I'd like to pick one or two questions here. I think my next questions relate to your questions, the audience. So um, there are many highly rated products in the market. Andrew, you know this, but certain ingredients used may not be suitable for everyone. So just now we talked about what are the ingredients to look for, but here let's look into more detail on what are the kind of ingredients that may cause irritation, and also because how do we know that we are allergic to a certain skincare brand? And also there was a question that is it, I think Sabaria was it? She was asking, is it necessary to do a patch test every time? How do you
Okay,
know that we're allergic?
so if you're allergic to certain skincare, there will be sign and symptom. Now. First of all, after using, you will feel like skin tightening. That's one
Mm,
sign. It may actually cause skin redness, another sign, and also skin itchiness. So if you feel after using the skincare product, you feel uneasy with all those signs, you should stop
mm,
the skincare products. And I mean, you will know it is actually not suitable. So to go for skin patch test or not actually depends. So let's say you know that is that skincare that actually causing the problems. You can
mm,
just stop the skincare and don't use anymore without going through the skin patch test. Unless you like the skincare product so much you doesn't believe it's due to that skincare product, then you can go for skin patch test in that
mm,
conditions. Yeah.
mm,
Not everyone need a skin patch test.
I see. So that's tightening, redness, or itchiness. Either or all of these symptoms show that you may be allergic, right, doctor? Okay. And I think when it comes to allergies, our minds always go for okay. Then the best would be natural. Logically, would be natural ingredients. So I think this goes to Andrew. Back to Andrew. Andrew, for you, what are the benefits of using natural products in the long term? And maybe you can mention, Oilum as an example.
Long term, you will not get best is no skin irritation. No redness, and then basically one thing is earth friendly. If you're not so-called cause damage to our skin and also environment, and then I think basically there's no side effect.
I see, I see. And I think I'm sure that the audience is excited to know more about Oilum. What is the recommended way to incorporate Oilum in our daily skincare routine? Some people they mix using different product, toner line, moisturizer different, and then cleanser different. For you, what is the best way to incorporate Oilum?
Basically, you see, come to the skincare is one. The first step is basically you need a cleanser.
Hmm.
So you can use a Oilum moisturizing soap or Oilum hydro rebalance cleanser. So basically this cleanser or the soap bar will help to moisturize your skin already when you
Hmm.
wash. And
Hmm.
then second step, you can use the Oilum Dermatologist lotion to hydrate your skin.
Hmm.
So this lotion is a bit special. If there is a non-greasy, if you absorb fast enough to your inner skin to provide hydration and then firm your skin and
Hmm.
also protect your skin.
I see. And where, this is the last question, where's Oilum available for the public who are interested? Because I feel from the testimony that we've seen just now, it's quite an interesting result. For the public who are interested, where can they find Oilum?
Oh, just how you answer for me already. It's
Yeah.
available in a private hospital.
Mm-hmm.
For instance, like Gleneagle Hospital,
Mm-hmm.
KL, and then Sunday Medical Center, and then some skin clinic,
Mm-hmm.
GP clinic, and also most of the community pharmacy.
Mm-hmm.
Mm.
Great, amazing. And Andrew and Dr. Low, I want to go quickly to the Q&A section in the comment section because I feel that there are a lot of interesting questions asked here. Let me go through one by one. Oh, there are a lot of people apparently that would love to win our giveaway. Wawa Woda is asking for Oilum, is this product safe to be used for children? What's your recommendation?
Yes, it's safe for children. Like those children have mild eczema, got dry skin, you can use the oil moisturizing soap.
Mm-hmm, mm-hmm.
Then after that, apply the oil lotion.
Mm. So Wawa,
That That's
mm,
how I share the testimony. Basically, it's a four
it's a
year old.
40-year-old.
Uh,
I see. Okay, so Wawa, I hope that answers your question. I think I saw a question about itch on the feet, Dr. Low, just now. I think Sabaria, no Sabaria, if you're still there, no Sabaria, yeah, let us answer your question about itchy on the feet. Is there a specific thing that you'd like to warn people about itchy on the feet?
Itchy on the feet, most of the time, it can be part of our any part of eczema lah. Means it can become together with our hand and feet eczema, and
Mm-hmm.
again we need to know what is the trigger. Let's say for feet, sometimes is that some people have a habit of cleaning the floor with strong detergents every day. They feel it's cleaner, it's more hygiene, no bacteria, no viruses, but
Mm-hmm.
if we do that, our skin is actually more exposed to these chemicals. It can actually cause our skin to actually have this skin itchiness and eczema. Of course, our footwear will actually play a factor. Let's say certain footwear, if your skin is very sensitive to like adhesive, glue, or even
Mm-hmm.
very sensitive to plastic or rubber content, then it can actually cause this skin itchiness. So if you have very resistant feet eczema, make sure that try to avoid strong detergents, strong chemicals over your leg. Try to avoid soak your leg in
Mm-hmm.
like a bathroom for too long. And
Mm-hmm.
if it persists, then you may need to seek treatment from your doctors lah.
Okay, I have a lifestyle question. This one is from me. Swimming, chlorine in the water, does that worsen eczema or is that really that doesn't affect it?
Okay, so chlorine in swimming pool, actually, if we our skin is not too dry, we swim like once a week. It actually can help to kill the excessive bacteria in our skin, like Staph
Interesting.
aureus. Yes, but if we
But
do it every day, it will actually make our skin worse by drying up because the chlorine actually is a very considered quite harsh things to our skin if we
mm,
do it like daily long hours, especially
mm,
if we have dry skin. So if you have dry skin, want to swim, use some moisturizer before you go and swim, and after that, wash away whatever residue of the chlorine.
that's why after swimming pool sessions, you're always advised to just hop into the shower real quick, right? Okay. We have a question from Aslan.
Yeah.
Amamia. I hope you're still there, Aslan. Quick question: what will happen to our face if we excessively use BHA on our faces? Maybe Andrew, you can take this on.
excessive
BHA.
excessive use of BHA basically it will cause a dryness to your skin. If those people who are dry skin, I think they will develop redness and
Hmm.
rashes. Uh,
If I have normal skin and I use BHA,
so
would that?
if normal skin, you use BHA basically to help you to feel the skin. to make you your skin look nice. So,
Mm-hmm.
but I think important thing is as I said, also the develop you call pigmentation. If let's say you protect your skin well, so those people who use the PHA, they need to use a very good sunscreen.
Mm.
So
And mm,
nowadays there are many sunscreen around. So there are sunscreen with is a greasy, oily, and then their sunscreen come with a moisturizer.
mm-hmm.
Mm.
And I think this is our last or second last question. Okay, some consumers believe that a good moisturizer is either drippy in texture or really thick in texture, like either two, right? So, from the perspective of a pharmacist and a doctor, maybe this is more for Andrew. What is the difference between water-based, oil-based, or wax-based moisturizer? Because Eng Li Shan is asking, could you comment on the use of ointment versus cream versus lotion type of moisturizers? What are the differences?
Okay, basically, in the market there are two types: water-based and oil-based.
Mm-hmm.
So for water-based moisturizer, for instance, basically is a lotion, which suitable for most of the dry skin. Even you can use for normal skin, combination skin, or dehydrated skin.
Mm-hmm.
Okay, for oil-based moisturizer, basically you just apply. There's a layer of the oil to prevent the water evaporation.
Mm-hmm.
So probably it give you some instant hydration.
I see.
So
So I think,
it all
mm,
depends on the individual and which type of the skin. So if widespread the whole body, I think lotion will be better. It can
mm,
apply wider so-called body surface, and then cream normally you apply a small surface. Mm.
okay, so I hope that answers your question, dear audience. And with that, I would like to, I think unfortunately, we've come to the end of the chit chat. But before we end, I would like to ask for a quick conclusion by Andrew and Dr. Low. Dr. Low, in your words, what is the main takeaway for this session for our audience out there?
Uh, uh, moisturizer. Full stop. Use the moisturizer like if you have dry skin, and try to win the oiler moisturizer to start with your new skincare routine.
Yeah,
And thank you, Dr. Low. Andrew, your thoughts, your final thoughts
my
on
final
dry,
thought.
itchy skin.
Yeah, I think same also moisturizer is important, and also the other one try to use cleanser with moisturizing effect.
Mm-hmm.
Okay, so you have a double push.
That
So
push.
moisturizing cleanser, moisturizer, then another moisturizer, then you can get a perfect skin. So especially this pandemic, COVID-19 pandemic, every day we have to wear face mask, every day use a sanitizer. So we have to face a dry and itchy skin
Okay, and I think
problem.
that really
So
helps.
this,
And dear audience, I would like
yeah,
to ask everyone to give your heart icons in the comment section for our Dr. Lo and Andrew Tan. Please give your hearts, everyone, in the comment section. I hope that they have given you all the answers that you need. And don't worry, you can still ask questions because Dr. Lo Diwen Dr. Nodiman will be answering your questions in the comment section afterwards. So don't worry, okay? And actually, Dr. Lo, you wanna do a quick shout out for your Facebook page?
Anyone want to ask some questions or some tips on the skincare? If you have acne, if you have eczema, you can actually go to my page, Ask Dr. Low, and you can actually ask your questions or learn some tips. Like just now, some people asking topical steroids. I make a short video on topical steroids. You can look at it. And
Mm.
retinol as well. Some people ask about retinols. You can search under my page. There will be answer for you. If you don't feel like that answer you can actually message me. I may come up with something or I may answer your questions straight away lah. Okay. All right.
Hey,
Thanks,
you know
Anish.
what? Hey, and audience, please, don't simply message Dr. Low because just because he's
Yeah.
handsome, okay? Make sure you ask because you legitimately want to ask a question, okay? And you know what? I would love to give a quick shout out for Oilum who is presenting the tonight's live event. And again, this is the giveaway that you guys can win, dear audience. Please keep the comments coming. Like, comment, and share. Tag your 5 friends. Comment below why do you need Oilum in your life, and allow me for the last time to share the wonderful benefits of the award-winning Oilum. So, Oilum, like I've mentioned, this is one of the most sought after products in pharmacies, in hospitals, in skin clinics, and why? For good reason. Because it's formulated by dermatologists, so you know it's legit, right? So it has olive oil, it has collagen, it can maintain the skin's natural protective function. It's rich in natural moisturizer and antioxidant. It's fragrance-free, paraben-free, and it's formulated with a non-greasy formula. And most importantly, recently it just won the Reader's Choice Award for Natural Health for lotion and moisturizing lotion and moisturizing cleanser category. So this is an award-winning set, you guys. Please make sure that you win. We are going to open the giveaway contest from now up until 6 p.m. Monday only. 6 p.m. Monday, we close, okay? And on Wednesday, we will reveal who will win. Who are the 10 lucky winners to win? Again, Dr. Low, Andrew Tan, it is my deepest pleasure to have you on. Thank you so much again from the bottom of my heart. Big heart here for our screenshot. So cute. And again, to our viewers, thank you for watching. Don't forget, you can still win our giveaway for one premium oil and personal care set. And it comes with a lotion, it comes with a cleanser, and all you have to do is just like our Facebook page, like and share this Facebook Live, comment why do you need the oil set, and tag 5 people. I hope with that you have learned a lot about dry, itchy skin today. I know I have. And again, we will announce the giveaway on Wednesday. Please make sure that you participate. Make sure you give good questions, okay? And with that, thank you everyone for watching. Thank you to our guests. Thank you to audience. My name is Hanis. Good night. Have a good weekend. See you next time. Bye.
Bye bye.